Have you ever experienced a sharp, nagging pain on the left side of your abdomen just under your ribs? It's not just uncomfortable, it can be downright alarming. But what could be causing this mysterious ache? Today we're diving deep into the causes and remedies of left side abdominal pain under the ribs. So sit back, relax, and let's unravel this medical mystery together. Before we get into the nitty-gritty, here's an interesting fact. Did you know that the spleen, stomach, pancreas, part of the colon, and even the heart can all cause pain in the left upper quadrant of the abdomen? That's right, this small area houses several vital organs, which means pinpointing the exact cause of pain can be a bit of a detective game. Let's start with some common culprits. Number 1, trapped gas. One of the most benign reasons for this pain in the left upper abdomen is trapped gas. Imagine a pain that's sharp enough to make you pause mid-sentence. A sudden jab just under the rib cage that might even radiate to the back or shoulder. This could be the result of trapped gas or a gastrointestinal issue like heartburn, where acid creeps up into the esophagus, causing a burning sensation that can extend upwards towards the throat. Trapped gas occurs when air gets stuck in your digestive system, and it's more than just a minor inconvenience. It can lead to bloating, abdominal pain, and an overall feeling of discomfort. But where does this gas come from? Well, it's a byproduct of digestion. As bacteria in your large intestine break down food, gas is produced. Sometimes we also swallow air while eating or drinking, which adds to the buildup. Now, passing gas is a natural part of life. On average, people do it about 13 to 21 times a day. But when gas doesn't move through your intestines as it should, it becomes trapped, leading to that familiar bloated feeling and sharp pains that can vary in intensity. So what causes gas to become trapped? It could be the result of eating certain foods that produce excess gas, like beans, broccoli, and onions. Or it might be due to a gastrointestinal condition that affects how gas moves through your system. The good news is, there are several ways to find relief from trapped gas. Physical activity can help move the gas along, so taking a walk after eating might be beneficial. Some find relief through abdominal massages or yoga poses designed to release gas. And then there are dietary solutions like sipping on teas made with ingredients known to soothe the stomach, such as peppermint, fennel, or chamomile. For those looking for immediate relief, over-the-counter remedies like simethicone can help. Simethicone works by consolidating small gas bubbles into larger ones, making it easier for your body to pass the gas naturally. But remember, while trapped gas is usually harmless, if you're experiencing it frequently or with other symptoms, it's important to consult a healthcare professional. They can help determine if there's an underlying condition that needs to be addressed. So the next time you feel that uncomfortable pressure building up, know that you're not alone, and there are plenty of ways to find relief. Number 2, constipation. If you are feeling the discomfort where the pain might be a deep, gnawing discomfort, persisting and making you feel uneasy. This type of pain could be associated with constipation, where the bowel movements are infrequent and stools are tough to pass, leading to a buildup that presses against the abdominal wall. Constipation is like a traffic jam in your digestive highway. It's when your bowel movements become less frequent, and the stools, stubbornly hard and dry, decide to overstay their welcome. It's a condition that affects millions, yet many hesitate to talk about it. The symptoms are unmistakable. The straining, the bloating, and that feeling of incomplete evacuation. It's a sensation that can range from mildly annoying to deeply distressing, often leading to a dull, persistent ache under the left ribs. But what brings on this digestive dilemma? Often it's a diet low in fiber, not drinking enough water, or a sedentary lifestyle. Sometimes it's certain medications or medical conditions throwing a wrench in the works. Fear not, for there are remedies at hand. Boosting your diet with fiber-rich fruits, vegetables, and grains can get things moving. Hydration is key. Water's your digestive system's best friend. And let's not forget the power of regular exercise. Even a daily walk can make a difference. For those times when nature needs a nudge, over-the-counter laxatives can help. But they're like a guest who shouldn't overstay their welcome. Use them wisely and sparingly. If the problem persists, it's time to call in the experts. Chronic constipation isn't just a nuisance. It can be a sign of something more serious. So, listen to your body, and if in doubt, seek professional advice. Remember, addressing constipation isn't just about comfort, it's about your overall health. By keeping the digestive traffic flowing, you're taking a vital step in resolving that mysterious pain under the left ribs. Number 3, enlarged spleen. When it comes to abdominal pain under the ribs, one potential suspect often flies under the radar: the spleen. This unassuming organ, nestled under your left rib cage, has a crucial role in filtering blood and fighting infections. But when it swells, it becomes a source of mystery and discomfort. An enlarged spleen or splenomegaly can be a silent intruder, often causing no symptoms until it's quite large. When it does make itself known, It's through a deep, aching pain in the upper left abdomen, sometimes extending to the left shoulder, a pain that can be both alarming and enlightening. But what causes the spleen to grow beyond its normal size? The reasons are many. Infections like mononucleosis, liver diseases such as cirrhosis, blood disorders, and even certain cancers. Each of these conditions can cause the spleen to work overtime, leading to its enlargement. The risks associated with an enlarged spleen are not to be taken lightly. A spleen that's grown too large can rupture, leading to internal bleeding, a situation that demands immediate medical attention. So how do we manage an enlarged spleen? The approach is twofold: addressing the underlying cause and protecting the spleen from further harm. This might mean medication to treat an infection, or in some cases, surgery to remove the spleen if it's causing life-threatening complications. Prevention also plays a part. Vaccinations, avoiding alcohol abuse, and protecting yourself from injuries can all help keep your spleen healthy. Enlarged spleen also causes some other symptoms such as fever and weight loss, frequent infections, anemia leading to weakness and fatigue, a feeling of fullness without eating or after eating a small amount due to pressure on the stomach, and of course pain in the upper abdomen, which may spread to the left shoulder. If you're experiencing any of these symptoms, it's important to consult with a healthcare provider for a proper diagnosis and treatment plan. Number 4, pancreatitis. Pancreatitis presents itself in two forms: acute and chronic. Acute pancreatitis is a sudden inflammation that lasts for a short time, while chronic pancreatitis is a long-term condition that can lead to lasting damage. The pain associated with pancreatitis is often described as a sharp, stabbing sensation in the upper abdomen that radiates to the back. It can be triggered or worsened by eating, especially high-fat meals, and is sometimes accompanied by nausea, vomiting, and fever. But what ignites this fiery condition? Common causes include gallstones, blocking the bile duct, heavy alcohol use, certain medications, and high levels of triglycerides in the blood. In some cases, the exact cause remains a mystery. Treating pancreatitis often involves hospitalization, where the focus is on resting the pancreas and allowing it to heal. Treatment may include fasting to let the pancreas recover, pain management, IV fluids, and in severe cases, surgery. Prevention is also a key part of the conversation. Limiting alcohol consumption, maintaining a healthy diet, and managing triglyceride levels can all help reduce the risk of developing pancreatitis. Other symptoms of pancreatitis may include nausea and vomiting, fever and chills, tender and swollen abdomen, diarrhea, fat and stool, steatorrhea, or weight loss without trying. If you're experiencing symptoms of pancreatitis, it's crucial to seek medical attention immediately. Early diagnosis and treatment are vital to prevent complications and ensure the best possible outcome. Number 5, kidney stones. In our quest to understand left-side abdominal pain under ribs, we've come across a condition that's as common as it is painful: kidney stones. These hard deposits of minerals and salts can form inside your kidneys and wreak havoc as they make their way through your urinary tract. Kidney stones can be stealthy, often causing no symptoms until they start to pass. The pain, however, is unmistakable. It's a severe, sharp pain that starts in the side and back, below the ribs, and can spread to the lower abdomen and groin. It comes in waves, fluctuating in intensity, and can be accompanied by a burning sensation during urination. But what causes these painful pebbles? Diet, excess body weight, certain medical conditions, and even some supplements and medications are among the many contributors. When urine becomes concentrated, minerals crystallize and stick together, forming stones. Passing kidney stones is no small feat. It can be quite painful, but the stones usually cause no permanent damage if they're recognized and managed in a timely fashion. Treatment can range from simple hydration and pain medication to more involved procedures like shockwave lithotripsy or surgery, depending on the stone's size and location. Prevention is key. Staying hydrated is crucial, as it dilutes the substances in urine that lead to stones. Dietary changes and certain medications can also help prevent stones from forming again. If you suspect you have a kidney stone, don't wait. Seek medical attention, especially if you experience severe pain, nausea, vomiting, or blood in your urine. Early treatment can help prevent complications and get you back to feeling your best. It's important to listen to your body. If the pain is severe, persistent, or accompanied by other symptoms like fever or vomiting, it's time to see a doctor. They can perform tests to diagnose the issue and prescribe the appropriate treatment. Remember, while some causes of left-side abdominal pain under the ribs are harmless, others can be signs of serious health issues. Never hesitate to seek professional advice when in doubt. We hope this video has shed some light on the possible causes and remedies for pain under the left ribs. If you found this information helpful, give us a thumbs up. And don't forget to subscribe for more health-related content. Until next time, stay informed and stay healthy.